Hello, I'm Felicia Ransom, and I am coming to you today to talk about the healthcare industry. I have worked as a claims consultant or claims coordinator for the past 15 years. And over the years, I've seen the healthcare industry drastically change. Um, it has become harder and harder to get a claim paid. Now we all pay, for insurance of some sort, be it full coverage, be it, a partial coverage. However, we all still pay for health care. And it is a growing concern of mine for us to continue to pay for healthcare coverage through our employers or whether we pay for it personally, however, we still pay for it. It's a growing concern of mine that the insurance industry has made it very difficult to even pay a claim. Um, Doctors' offices and hospitals are finding themselves having to fight more and more each day just to get their money for the services rendered. The reason being is because of Congress. They've passed many laws that don't really protect the consumers when it comes to healthcare. And a lot of the customer services through healthcare insurances, it's over in India or some third world country. And a lot of times they're unreachable. A lot of times you can't even speak to them in regards to why they didn't pay the claim or why it is that, you know, they're needing further documentation to support the claim. It is a criteria that has been passed along for many years, whereas if we submit a claim to an insurance company, then we have to submit the supporting documentation as well. So, whatever it is that they're needing, whatever it is that you go into the doctor for to have done, the doctor has to document every single step of that surgery. They've also made it very difficult for physicians to not document those things. They're often penalized or fined for not proper documentation. So, when a insurance company says, "Well, we didn't receive the operative report to support this claim," it's not true. It's a tactic of theirs to put off paying high dollar claims. They look for reasons to deny a claim going in the gate. They look at that claim, they make sure that all the I's are dotted and all the T's are crossed before they'll even assess the claim properly. So it's a growing concern because, like I said, we continue to pay for insurance and our employers continue to pay for insurance, but our insurance companies are not paying out anything. They receive a lot in, but they don't pay out anything. And it's really a legalized racket, so to speak. What they're doing, it should be illegal, but it's not. So, and a lot of times, individuals, just your average individual, you really don't even pay attention to things like that because you're sick. Like myself, I'm sick, but because I know what to expect and I know what's needed to get my claims paid so that I don't receive this huge outrageous bill, I know what to look for. I know what's supposed to be done. I know how to follow up on that properly. I know what to say to the insurance company when I call. I know to say, "Hey, has my surgery been pre-authorized? Hey, because I need this surgery paid." I make sure that I've done my coordination of benefits. And what a coordination of benefits is when you have one or two insurance companies that you pay insurance for. So that means that your primary insurance carrier needs to know that you have a secondary insurance carrier so that they will know, hey, we only have to pay a portion of this claim and what's left goes to the secondary insurance. So I know to make sure that all of that is coordinated prior to having surgery, prior to going to the doctor. I mean, even if I'm going to see the pharmacist or to pick up my medications, I know to find out if I have both insurances filed properly so that my out of pocket is at the very minimum. The very minimum. So these are things that you want to pay attention to. Pay attention to what your percentage is when you get ready to pay that leftover, medical bill that's sent to you in the mail. Pay attention to what's paid and what's actually not paid. Ask questions. Find out if whatever it is that you're being offered or whatever procedure you're having to have done is actually a covered procedure. Otherwise, you'll find yourself out of even more money than what you've already paid. Thank you.